Well, thank you for having me here. I've never been to a meeting that got so fired up in the morning. I love it. We're talking about dry eye. So we've talked about three things I've been hearing over and over: depression, inflammation, and pain. And I've got the thing that treats all of that. Now, everything I'm going to be covering today is in my book. I'm going to push my book here, Toyos Dry Eye Diet. You can get that on Amazon or Apple or Barnes & Noble. I talked about low-dose naltrexone way back in 2013. I've been using it ever since. I actually use it personally. So what is this? Naltrexone is used to get people off of opioids. So it's an opioid receptor blocker. So if you're hooked on opioids, you take naltrexone, it blocks those receptors. So when you take your opioids, you don't feel anything that you normally would feel. But we know with low doses, it does a couple of things. It decreases all the inflammatory mediators. It actually lifts up your mood. That's why I was so calm and excited today to come in. I took my low-dose naltrexone. And it decreases pain. So in 1984, how they discovered this is they had a bunch of AIDS patients that they didn't know what to do to control their pain. So doctors started to use naltrexone. That didn't work. But when they use it in really low doses, these patients with AIDS started to feel better. They weren't feeling pain, and they could control them. Then it was used in MS patients to control pain, and it did. I went to an anti-aging conference, and they were talking about low-dose naltrexone for pain, and I had plenty of patients, like she was describing, that had such dry eye pain that they couldn't function, they were depressed. So I decided that I was going to try that. And I tried everything else. I tried nortriptyline, I tried gabapentin, I tried Lyrica. Lyrica seemed to work just a little bit. That's for diabetic pain. But then I started using low-dose naltrexone, and patients were doing really, really well. So what I decided to do was I decided to compare Lyrica to low-dose naltrexone for pain in my patients with severe dry eye pain. And what I found is Lyrica didn't work at all. And about 50% of my patients who were on low-dose naltrexone, they found that they had 50% decrease in their pain. And I've been using it ever since. So studies have shown that actually low-dose naltrexone can decrease all the inflammatory mediators in the body, but especially when you're talking about dry eye, the most specific inflammatory mediator is actually interleukin 17. So if you can control interleukin 17 in your dry eye patients, you can actually control their inflammation. Where does interleukin 17 come from? T cells make T helper cells, and T helper cells make interleukin 17. So if you want to control pain and inflammation in these patients, what you have to do is you have to use a T cell immunomodulator. That's why cyclosporin works, right? Cyclosporin is a T cell immunomodulator. So this is showing you what I'm saying in terms of reducing interleukin 17. Now, how many people here use doxycycline or tetracycline? Don't use it. Do you know why? And don't listen to dudes. We're talking about gut microbiota. You know what's the number one reason and the number one antibiotic that kills all the good microbiota in your gut? It's tetracycline and doxycycline. So we have to get rid of that and get rid of that idea of using doxycycline as a way to decrease inflammation, especially since we have low-dose naltrexone. So a recent paper confirmed what I showed was that low-dose naltrexone is a great way to decrease inflammation. So this is a paper out of Harvard. Mine was prospective, theirs was retrospective. All right, so how do we use it? So I don't want to do anything that actually can damage our gut microbiota. I don't know if low-dose naltrexone would do that, but we use it sublingually. And how do you use it? So what we do is a 6-week buildup. So every day I have patients take this sublingually. For the first 2 weeks, they go 1.5 milligrams. 2 weeks after that, they go 3.0 milligrams. And 2 weeks after that, they go 4.5 milligrams. Low-dose naltrexone actually stays in your system for 30 days. So after you do that buildup, you don't have to use it every day. What you do is you can use it once a week or twice a week. And then if the patient has a flare-up, they can go ahead and use it to control their flare-up. So I use it about 3 to 4 times a week on myself. If I'm having joint pain or my eyes are bothering me or I'm traveling or I'm doing something that has a lot of inflammation, I'll go ahead and do some more low-dose naltrexone. So I have 12 years of experience, I have hundreds and hundreds of patients. The only downside, and it's not really a downside, is the first couple of weeks you use low-dose naltrexone, you'll have a lot of lively dreams, but haven't seen any other downsides to using low-dose naltrexone. So we just need to do some more future studies, but instead of using doxycycline or tetracycline or any of these, I would actually use low-dose naltrexone. Thank you.
Thank you.